lining up for tests. Too late to stop the spread.
Without testing, it is like an airplane flying without visibility. We have no idea of what is actually going on the ground.
It didn't have to be like this. In January, South Korea began aggressively testing and isolating suspected coronavirus carriers. It now has only around 100 new cases a day. If America had done the same,
we would have avoided having lockdowns at the level we have now. We have to work from where we are right now, and that still requires massive testing.
What does massive testing mean?
Probably means over 1 million tests a day.
Complicating the picture, there are multiple types of test. The most effective, called PCR, looks for traces of the virus, but results can take hours. The tests themselves in short supply. On Monday, President Trump displaying a new, quicker PCR test, fast approved by the FDA. From tomorrow, thousands of these tests will be available in America. While in the UK, this Oxford University team is showing us how they are making the process even simpler.
The pink is negative, the yellow is positive.
Another type of test, now FDA approved, looks for the antibodies that fight the virus. A simple blood sample in a cassette, like a pregnancy test. Antibodies to the virus appear days after infection, showing who has had coronavirus. But they might help governments calculate when and how to safely lift the lockdowns. And for the world to get back to business, technology is playing its part. Governments and companies around the world are increasingly expressing interest in legally accessing location data from unsuspecting cell phone users to track changes to their movements. While the data is gathered anonymously to map how effective self-distancing measures are, it has raised privacy concerns. Researchers designing an app that alerts people who've been in contact with you if you test positive.
This is not about surveillance. This is about contributing to control of the epidemic.
Coronavirus is testing our communities and our trust in governments. But without effective testing, the world is fighting an enemy it cannot see, and a vaccine or cure are months, maybe years away. The World Health Organization has urged countries to track and trace everyone suspected of having the virus. Health experts here in Europe now saying the secret of ending the lockdowns? Mass testing.